Welcome dear learners. In this module, we would like to discuss about ophthalmic dosage form further. After learning this module, you will be able to develop your understanding about preparation of ocular drug delivery system, their containers and their packaging. The lesson plan will move like: first we will cover the manufacturing of ophthalmic preparations, and then we will move to the packaging of ophthalmic preparations. Now, starting with the manufacturing of ophthalmic preparations. In this category, I would like to discuss first the eye drops. The preparation of eye drop involves the preparation of solution as the first step, clarification as the second step, filling and then followed by the sterilization. The first step in the preparation of eye drops is the preparation of the primary solution. The aqueous eye drop vehicle containing any necessary preservatives, antioxidant, stabilizers, tonicity modifiers, viscosity enhancers or buffers should be prepared first. Then API is added and the volume made up to the required. The second step is clarification. All the formulations should be free from particulate matter and the bacterial endotoxins has stringent requirement for their absence. It means there should be no bacterial endotoxin present in our formulation. The sintered glass filter or membrane filter of specified micro-millipore size are suitable for this technique. The clarified solution is either filled directly into the final container, which are sealed prior to the heat sterilization, or filled into the suitable container to filtration sterilization. There are two techniques: one heat sterilization and then second one is filtration sterilization. We will discuss it in later mode. Clarified vehicle is used to prepare eye drops suspensions also, which are filled into the final container and sealed prior to the sterilization. Last step is sterilization by autoclaving at 115 degrees centigrade for 30 minutes or 121 degrees centigrade for 15 minutes. Heating at 115 degrees centigrade for 30 minutes together with either benzalkonium chloride or phenyl mercuric acetate or phenyl mercuric nitrate or phenyl mercuric thiomercerol. This method is described in BP, but it is no longer a pharmacopoeial recommended method. So, what we use? We use filtration through a membrane filter. Filtration through a membrane filter having 0.22 micro-millipore size into sterile container using strict aseptic techniques. What are those techniques? The same we use in the parenteral dosage forms. The dry heat sterilization at 160 degrees centigrade for 2 hours employed for non-aqueous preparations, and silicon rubber treat must be used in that case. Immediately following sterilization, the eye containers must be covered with the readily breakable seal to distinguish between the opened and unopened container. Now, the second formulation type is ophthalmic suspensions. We know the suspensions, these are the formulation containing dispersed solid in an liquid vehicle. In case of ophthalmic suspensions, these are used to increase the corneal contact time of a drug substance, provide a more sustained action. These suspensions included those solid preparations that when reconstituted according to their label instructions. These are required when the active ingredient is insoluble or is unstable in solution form. So, this is the reason why we prepare suspensions, because the active ingredient is either insoluble or unstable in solution form. Ophthalmic suspensions commonly formulated by dispersing micronized powder drug. The size should be less than 10 micrometer in diameter of that micronized drug powder. In powdered form, the drug may have a much longer shelf life than the solution or suspension. So, what we can do? We can store the powdered drug and then mix it when the time of administration comes. What are the disadvantages of suspensions? Concentration of dissolved drug cannot be manipulated due to their relative insolubility, because if we increase the concentration but the drug have restricted solubility, there will be no benefit. Now, the third type of preparations are ophthalmic gels composed of mucoadhesive polymer. Mucoadhesive polymer have the property to adhere with the mucous membrane. These gel provide localized delivery of API to the eye, because they attach, the formulation adheres to the particular part of the eye. Such polymers have a property known as bioadhesion, because it is a biological membrane. So, the mucoadhesion is also known as bioadhesion. These polymers are able to extend the contact time of the drug with the biological tissues, and which results to improved ocular bioavailability. The choice of polymer plays a critical role in the release kinetics. So, we have to choose the polymer very precisely. Literature can help on that. Now, the next formulation is eye lotions. How we formulate the eye lotions? Eye lotions used to assist in cleaning of external surface of the eye. It removes non-impacted foreign body or clean away the conjunctival discharge. For surgical use, in surgical or first aid procedure, should not contain antimicrobial preservatives and should be single use containers only. Preparation is very simple. The most common constituent of the eye lotion is normal saline. What are the requirement of eye lotions? Sterile and containing no preservatives. Isotonic with lacrimal fluid. It means the concentration of iron should be equal or equivalent to the lacrimal fluid. It should be in of neutral pH. The large volume is allowed, but not should be greater than 200 ml. Non-irritant to the ocular tissue. The eye lotion should be non-irritant. What are the label indications in case of eye lotions? The label should indicate the title identifying the product and the concentration of contents. Sterile until open, not to be taken, use once and discard the remaining solution. Expiry date, these are instructions should be necessarily mentioned in the label of an eye lotion. The preserved eye lotions would need additional labels like avoid contamination of the contents during use. Discard remaining solution not more than 4 weeks after first opening. Lotion should be applied in colored fluted bottles and sealed. So, these are the labeling methods of the eye lotions. The next formulation is eye ointments. What are the advantages of eye ointments? It provides greater total drug bioavailability. These are of semi-solid type. So, they provide greater total drug bioavailability, but they take longer time to reach the peak absorption, because the drug release is limited by the matrix system, which we generally see in case of any semi-solid preparations. What are the disadvantages? Temporarily interfering with the vision, as these are of semi-solid type, so they prepare a layer or they form a layer over the corneal portion of the eye and which interferes with the vision. Requirements of eye ointments. What are the basic requirements? It should be sterile in nature. How we can do that? Either by autoclaving or by the filtration method before preparation, and the formulation and packaging in the aseptic areas. It must contain suitable antimicrobial preservatives, antioxidant and stabilizers. USP offers chlorobutol, parabens and organic mercurials as the preservatives or stabilizers. Any eye ointment must be free from particulate matter, and the particle size of any solid particle present in the eye ointment should be reduced in less than 25 micrometer range. What are the basic components? Liquid paraffin 1 part, wool fat 1 part, yellow soft paraffin 8 parts and hard paraffin as required to produce required consistency in hot climates. So, you can see that the basic formulation composition of the ointment in case of ophthalmic ointments is similar to the common ointment. We use ointment base and then incorporate the drug. The main difference is the processing. This should be aseptic or sterile in case of ophthalmic ointments. Now, how we prepare eye ointments? First, we prepare the base, prepared using aseptic techniques to incorporate the finely powdered active ingredient or a sterilized concentrated solution of the medicament into the sterile eye ointment base. Immediately after preparation, the eye ointment is to be filled into the sterile container, which are then sealed. The screw cap should be covered with a readily breakable seal. Certain eye ointment can be sterilized in their final container using ionizing radiation. So, there is one more technique to sterile the eye ointment. What is that? Ionizing radiation. We can also use the radiation technique of sterilization to sterile our eye ointments. As we use the eye ointment base, how will we prepare that? The first step to prepare eye ointment base is the paraffin and the wool fat are heated together and filtered while molten because of the sterility requirement. How we filter that? Through a coarse filter paper in a heated funnel into a container which can withstand dry heat sterilization temperature. The container is closed and contents are maintained at 160 degree centigrade for 2 hours for sterilization in oven. General method of preparation: liquid paraffin, cytosterile alcohol, hard paraffin and soft paraffin in a melting vessel. We should add all these contents. Then step 2, heat to 145 degree centigrade and keep it at this temperature for 45 minutes. Allow to cool to room temperature. In a separate vessel, dissolve the drug in 200 ml of water for injection and add to prepared base under aseptic condition. So, you can see that we are using water for injection here. Why not distilled water? Because that should be sterile. Any vehicle we are using, that should be sterile, and water for injection itself, it is sterile already. Now, fill and sterilize the formulation in tubes, and how we will sterilize these tubes? By gamma radiation. Now, the next formulation type is ocular inserts. Solid dosage forms ocular inserts ophthalmic inserts are defined as sterile, solid or semi-solid preparations which are thin, flexible and multi-layered structure for insertion in the conjunctival sac. What are the advantages? Why we prepare them? Increasing contact time and improving bioavailability. So, we have suspensions, ointments and now ocular inserts which are prepared to increase the contact time and improve the bioavailability. So, these two factors must be very important. Why? Because we are working repeatedly on them. We are advancing our formulations, contact time and bioavailability. The next advantage is providing a prolonged drug release. This is again a derivative of bioavailability and thus a better efficacy we can achieve by using ocular inserts. It also reduces the adverse effects and the reduction of a number administrations and thus better patient compliance. We do not have to use or instill it again and again in our eye. Just use at single time and then the drug will be released for a longer period of time without instilling any other formulation to the eye, which assures about the better patient compliance in the future. There are again another category is of insoluble inserts. Insoluble insert are a multi-layered structure consisting of a drug containing core surrounded by each side of the layer of a copolymer membrane through which the drug diffuses to the system at a constant rate. The rate of drug diffusion we can manipulate it, we can control it by the polymer composition, the membrane thickness and the solubility of the drug. Sometimes we alter the solubility of drug to control the diffusion rate. One example is here Occusert Pillow 20 and Pillow 40 ocular system designed to be placed in the inferior cul de sac between the sclera and the eyelid and to release pilocarpine continuously at a steady rate for 7 days for the treatment of glaucoma. And what it consists? It consists of a drug reservoir, pilocarpine free base and a carrier material like alginic acid to contain the drug in that reservoir. Another constituent of that formulation is a rate controlled membrane which is prepared of ethylene vinyl acetate EVA copolymer. This membrane is used to control the rate, diffusion rate which we were talking about of the ocular insert. This is of insoluble type. Now, soluble ocular inserts. Soluble inserts consists of all monolithic polymer devices that at the end of their release the device dissolves or erode. We do not have to remove it manually. What are the types? These are of two types based on the natural polymers like collagen and based of the synthetic or semi-synthetic polymers like ethyl cellulose derivative HPMC, hydroxy propyl cellulose, methyl cellulose or polyvinyl alcohol PVA, ethylene vinyl acetate EVA copolymers like. Soluble ocular inserts, the system soften in seconds after introduction into the upper conjunctival sac, gradually dissolves in 1 hour while releasing the drug. What are the advantages? Being entirely soluble so that they do not need to be removed from the site of application. Now, next category is ophthalmic implants. To extend the release of the drugs in ocular fluid and tissues, particularly into the posterior segments. Implants mean we have to plant them there. On the basis of their degradation property, we can classify these implants into two categories. Number one is biodegradable and second one is non-biodegradable. It can be solid, semi-solid or particulate based delivery system. Specifically in case of particulate systems, it can be injected through thin needles and have different behavior and distribution in the ocular media depending on their size and composition. Biodegradable polymer include polylactic acid, polyglycolic acid, polylactic coglycolic acid PLGA block copolymer, and in case of non biodegradable polymers PVA is mostly used. Bulk erosion occur causing a burst of encapsulated drug caused by the cleavage of polymeric chains by enzymatic and non-enzymatic hydrolysis. So, the polymeric chain present in the system cleaved because of enzymatic or non-enzymatic hydrolysis process, which causes the erosion of the encapsulated drug. These are manufactured in various shapes like rods, plugs, pellets, discs and sheets. These are implanted into the interior chamber or in vitreous cavity or at the pars plana or into the intrascleral space. These are the locations where we can implant the ophthalmic implants. Now, in the last portion of this module, we would like to discuss few things about the containers and the closure systems which we use for the ophthalmic preparations. The ophthalmic liquid products were packed in the glass containers fitted with an eyedropper. We have seen most of the preparations of ophthalmic type in the glass containers majorly, but now the technology is getting more and more advanced and we can see the change in container techniques also or packaging techniques also. Today glass containers have limited use where the product stability or compatibility issue excluded to use the flexible plastic containers made of polyethylene or polypropylene. It explains that in most of the cases we try to use the flexible plastic containers. If the drug has stability or compatibility issue, then only we try to use the glass containers. The plastic containers, these are made up of flexible type of polyethylene or polypropylenes. Most liquid ophthalmic products on the market are packaged in the plastic containers fitted with the nozzle, from which by gently squeezing the contents may be delivered as drops. It is very easy to use when the formulation is packed in plastic container, as the glass container is not very much flexible. So, we have a difficulty, we face a difficulty to administer as a drop, we cannot squeeze it. In case of plastic container, we can gently squeeze and the drop formed and gets delivered into the site of administration. Plastic container have several advantages over the glass dropper combination. It minimizes the risk of the contents being contaminated with microorganisms by the replacement of the dropper. We do not have to replace the dropper, which may have become contaminated by the touching the infected eye or any other surfaces. In case of glass, this happens. The dropper gets contaminated by touching the infected eye or any other surface, and then we have to replace it. In case of plastic, as we can squeeze them, so we can administer the drug from a distance, and by that we limit or we can restrict the touching of the dropper from the infected eye or any other surface. Plastic containers are cheap, light in weight, more robust to handle and easier to use than the glass dropper type containers. There are few disadvantages of plastic eye drop containers. What are those? Some plastic materials such as polyethylene can absorb some antimicrobial preservatives like benzalkonium chloride. It means polyethylene reacts with the benzalkonium chloride in simple way, or some other drugs. They may also leach plasticizers into the product. This is another a big problem. The printing inks from the label can migrate through the plastic into the product, and this is again a very much thinkable disadvantage of the plastic eye drop containers. It is necessary to conduct compatibility and stability studies to ascertain whether this is likely to be a problem when we use or choose the plastic as a container type. Another thing we can do, we can use the alternatives glass or a preservative free product. If there is a compatibility or stability issue, we can use glass or preservative free product. The challenge is to develop a packaging system for preservative free product. It is very difficult, that maintains the sterility of the product throughout its shelf life and during use. Preservative, what they do? They maintain the sterility of the product throughout its shelf life and during use. So, we cannot replace them, or we cannot formulate the system without preservatives. So, what we can do after that? Plastic container can also be permeable to water vapor and oxygen over prolonged period of storage. There is again a problem. This can lead to gradual loss of liquid product or oxidation of an unstable drug over time. Polyethylene containers are not able to withstand autoclaving and are usually sterilized by ethylene oxide or by irradiation before being filled aseptically with the pre-sterilized product. So, sterilization techniques are also limited in case of polyethylene containers. Polypropylene containers can be autoclaved in comparison with the polyethylene, but are not so flexible as polyethylene for eyedropper use. So, we can use polypropylene containers for those formulation which are not to be instilled in the eye, like ointments, but we cannot use polypropylenes when we require a dropper system in ophthalmic preparations. So, to solve all these problems, we have to first check the compatibility and stability of the drug product with the container system. If the drug formulation or the formulation is not compatible with the plastic container, we should go for the glass containers. It will be bit difficult to use, but the drug will be safe in that container type. Now, I would like to summarize the lecture. In this lecture, we learnt about various types of ophthalmic formulations. We also discussed about the method of preparation of few formulation aspects. We also covered the merits and demerits of various formulations, and at last we had gone through the packaging techniques with specific to ophthalmic dosage forms. Please go through the suggested further readings. Do take part in the discussion forum if you have any query regarding the content of this module. Thank you so much for paying attention.